Welcome to this week's edition of Tahoe Talk. We're joined today with Dr. Stephen Tan. Dr. Tan, you're from the Carson Tahoe Cardiology Department?
Correct.
Where are you located? And maybe give us a little overview. We have, some of the docs come in from Barton Hospital all the time, but I think this is our first visit from the Carson area.
Yeah, I think it is. Thanks for having me. We're a 9-member cardiology group. Our offices are on the campus at Carson Tahoe Hospital, which is on the north end of Carson City. It's a beautiful facility, really state-of-the-art, not only cardiac care, but other subspecialties. But for us, we have an outpatient clinic where we see patients and we do non-invasive studies like stress testing and echocardiography. And then in the hospital, we have a full complement of cardiology services, including invasive and interventional services, which is what I do, but we also do pacemakers. But we have really a remarkable facility for the area that we're in.
Kind of hard to miss if you ever travel to Reno. It's right on the left as you look at the on and off ramp off of 395. We're talking about heart risk. Who's at more of a risk, men or women?
Well, that's not a straightforward question. The answer really is both, and it depends on the person's individual risk factors. In general, at younger ages, men are at greater risk. But something we've been trying to draw attention to over the last several years, and kind of is headlined by the Red Dress campaign of the American Heart Association, is that women in their perimenopausal years, as they go through life's change, they very rapidly catch up to their male counterparts once they lose the protective effects that estrogen has on their hearts. So after that age group, which is typically in the 50 to 55 age range, women very rapidly catch up and become equivalent in terms of only a sex difference. From there, then everyone, there are other classic risk factors like blood pressure, diabetes, smoking, etc. But for men and women, to compare them directly really depends on the age.
There are usually some warning signs for the onset of a heart attack. Do they differ for men and women?
They do, and that's another sort of main point that we try to drive home with the Red Dress campaign. Women, they're much less likely to have classic symptoms of angina or chest pain if they have developing cardiovascular disease. Men are much more likely than women to have sort of the classic description of, I have an elephant sitting on my chest when I exert myself. It goes away when I rest. I get short of breath or nauseated or sweaty when the symptoms happen. Men are much more likely to have that sort of classic textbook presentation than are women. So when we see women who have risk factors for cardiovascular disease and you're talking to them getting a history, we as healthcare professionals have to be a little bit more sensitive to subtler signs. Sometimes it's as simple as unusual fatigue or loss of tolerance for exercise. Sometimes it's more vague symptoms like less typical chest discomfort or shortness of breath. But regardless, you really have to pay a little bit more attention to their risk and be more in tune to subtle symptoms when it comes to women.
Well, Doc, we appreciate you coming in and state-of-the-art facility down there in Carson City at the south end of the town. Thanks for taking time to join us.
Thank you for having me.
All right, that'll do it for this edition of Tahoe Talk. We'll see you next week.